Well, welcome, Minister Cho, and your colleagues from the Ministry of Health and Welfare of the Republic of Korea to both Seattle, but especially here to UW Medicine.
UW Medicine welcomes South Korea's Minister of Health and Welfare, Kyoo to share ideas about healthcare hurdles and solutions.
Currently, Korea is dealing with a large number of doctors love to work in large cities, urban areas, not rural areas. That's why many rural areas are suffering physician shortages. So we have to think about how to deal with, how to meet that challenge.
We believe that if we can train them in these small towns, they start to build relationships with those towns. They recognize that value of practicing in those towns. And so when they get done with their training, they're much more likely to come back. When you look across all of our states, the return rate is roughly 60 to 70%.
The discussion also covered the School of Medicine's emphasis on both research and patient care.
The University of Washington is very unique to have that combination of both serving rural environments, but also really excelling in not only just the research funding, but the quality of the research. We believe that makes us better for our patients because we can offer newer treatments, novel therapies, and really innovate in a way that allows us to offer the most advanced medicine and medical care for our patients.
As they're being recruited, we work to set aside time in their schedule for research and also mentoring to help them build up their research programs. So they typically get assigned mentors to help them write grants to support their research time.
Another key topic, preparing for future pandemics.
Although Korea is recognized as one of the best countries to overcome COVID-19, however, I believe we shouldn't be complacent with the current situation. We should be ready for another possible pandemics.
I do think we're always worried about new viruses and the potential, and hopefully we have learned from this last pandemic. We are fortunate that the science continues to advance. So for instance, when COVID-19, when we first heard about unusual cases of pneumonia in China back in the fall of 2019, within a month of that, there was a full virus sequence at the beginning of January in 2020. And a few weeks after that, our virology lab, developed our own internal test to be able to test for that virus. 10 years ago, we couldn't have done that. But because science has advanced and genetic sequencing has advanced, that we are able to do that much more quickly. And we had vaccines within 12 months that were safe and effective. And we need surveillance systems to be able to detect at the very first moment when a new pandemic may arise.
Over here, because we've got the vaccine.
The minister also toured UW Medicine's Institute for Protein Design, which developed a nanoparticle COVID-19 vaccine that was first approved and distributed in South Korea by SK Bioscience. The minister thanked everyone for their insight and said he'd build on the ideas that were shared while implementing and establishing future policies. UW Medicine would also like to thank Minister Cho and his delegation for their visit.